Hi everybody, this is Dr. John Hayes and I'd like to welcome you to this week's edition of Beating Neuropathy TV. Today what we're going to do is talk a little bit about one of the more common forms of peripheral neuropathy, and that's the peripheral neuropathy that's associated with chemotherapy. You know, chemotherapy has come such a long way in the last few years and it will continue to improve as time goes on. But one of the unfortunate side effects for so many patients who have undergone chemotherapy, not necessarily just due to cancer, but other diseases like rheumatoid arthritis, ulcerative colitis, etc., is that they go on to develop a peripheral neuropathy. This is very frustrating for oncologists. In fact, I remember having a conversation with an oncologist not too long ago that neuropathy was indeed his biggest frustration with treating his own cancer patients. So the problem is well known. But what is lesser well known is that you don't necessarily have to live with the side effects of chemotherapy neuropathy. Now, we can't help every patient, but the good news is we've made exceptional progress in the last few years. We use a combination of therapeutic modalities in the clinic, such as neurostimulation, LED, laser therapy, and where appropriate, nutritional rehabilitation, or what I like to call metabolic rehab, which we do orally and topically. The other thing to keep in mind is that the extent of your neuropathy will to a large extent determine how long treatment might take. Also, the longer you wait, the worse it can be. One other thing I do want to mention is that there is some evidence that patients who undergo treatment for the neuropathy during chemotherapy may actually have a far better therapeutic outcome. One of the things I'd like to show you today is one of the devices that we've been using to successfully help patients who suffer from chemotherapy-related peripheral neuropathy. This is a neurostimulator device that can be connected in a number of different ways. You can see it's a small portable handheld device powered by a rechargeable battery. It has a couple of electrodes that can be used either with adhesive electrodes or with conductive garments. One of the things that I really like about these units is you can use them to treat yourself at home, and with your oncologist's permission, you can actually use these during chemotherapy infusions. Again, this represents one of the wonderful advances we now have for patients that suffer from chemotherapy-related peripheral neuropathy. So what can you do today? The first thing I would recommend you do is to learn so much more about what we can do for peripheral neuropathy in general and post-chemotherapy neuropathy specifically. What I would recommend you do is to grab a copy of our books if you don't own them already, read the specific articles and references. Also supplement this by joining us on a regular basis on Facebook at facebook.com/beating neuropathy. Keep in mind, there's a lot you can do. We want you to focus on positive outcomes. We want you to focus on the things that you can actually do today to help reverse the effects of your peripheral neuropathy. Once again, it's been a pleasure to be with you today. Thank you for inviting me into your home, and we'll see you on the next episode of Beating Neuropathy TV.